Current healthcare environments are filled with complexity. Many factors such as technological innovations, complicated healthcare needs of clients, demanding workloads, the proliferation of sometimes conflicting evidence, politically complex environments, and a myriad of ethical issues require practitioners to think on their feet and discern how to respond effectively in the midst of complex practice situations. Reflection can help to navigate this complexity. Recently, there has been growing acknowledgement of the importance of reflective practice in professional life and in the cultivation of knowledge relevant to healthcare practice. Yet, integration of reflection can be challenging, given the current fast-paced environment of many healthcare practices. We hope that this walk along the path of reflective practice will help to prepare you to integrate reflection into your own professional life, to learn from the experiences that arise in your practice, and to become a more thoughtful, responsive, and effective practitioner. Reflective practice was popularized by Donald Scone in his seminal book, The Reflective Practitioner: How Professionals Think in Action. Scone defines reflective practice as a dialogue of thinking and doing through which I become more skillful. He describes the knowledge professionals develop through reflection as related to both thinking and doing. Reflection is related to intentional cognitive thought, but also to what we do, such that reflection is also embodied and revealed in action and in the often tacit performance of professional skills. Scone's ideals about reflective practice draw on the work of philosopher of education John Dewey. Dewey defines reflection as an active persistence and careful consideration of any belief or supposed form of knowledge in light of the grounds that support it and further conclusion to which it tends. Reflective practice emphasizes how practitioners use reflection to learn from experience to improve their professional practice. It recognizes that practitioners use reflection to make sense of uncertain, ambiguous, or conflicted situations in practice. Reflective practice often begins when a routine response produces a surprise, an unexpected outcome, pleasant or unpleasant. The surprise gets our attention. When intuitive, spontaneous performance yields expected results, then we tend not to think about it. However, when it leads to surprise, we begin a process of reflection. Philosophically, reflective practice is much more than a series of techniques or skills. It is a whole way of thinking about what it means to know in professional life. Reflective practice recognizes knowledge as arising through reflection in the midst of practice-based experience and retrospectively following events in practice. It is as much a philosophy of knowledge, what some call an epistemology of practice, as something we do as reflective practitioners. We welcome you to this module, which offers an introduction to reflective practice for health and social care practitioners.